immune globulin, which contains antibodies that will attack the virus in your body. However, this injection only confers temporary protection, so it is followed up with the series of 3 hepatitis B immunization shots. There is no treatment to prevent you from getting hepatitis C infection after an exposure. Post-exposure treatment for tuberculosis will not begin unless your tuberculin skin test is positive during the monitoring period. In those cases, a long period of treatment with oral anti-tuberculin medicines will begin. There are very few infectious exposures for which you will receive antibiotics. Significant exposure to pertussis, and some types of bacterial meningitis would be included. Scene safety. The personal safety of all those involved in an emergency situation is very important. In fact, it is so important that it is best that you internalize the steps necessary to preserve personal safety so your actions become automatic. A scene that appears safe initially can develop into a hazardous situation at any moment. Take care to notice any suspicious person or activity at the scene, because your first priority must be your own safety. A second accident at the scene or an injury to you, or your partner creates more problems. Delays in emergency medical care for patients increase the burden on other emergency medical technicians and may result in unnecessary injury or death. You should begin protecting yourself as soon as you are dispatched. Before you leave the scene, begin preparing yourself mentally and physically. Make sure you wear seat belts, including both the lap belt and shoulder harness, en route to the scene. Also make sure to wear seat belts and shoulder harnesses at all times during transport unless patient care makes it impossible. Many emergency medical service units have mandatory seat belt policies for the driver at all times, for all emergency medical technicians during transit to the scene, and for anyone who is riding with a patient. Don the appropriate personal protective equipment prior to departing the ambulance. Protecting yourself at the scene is also very important. A second accident may damage the ambulance, and may result in injury to you, or your partner, or additional injury to the patient. The scene must be well marked. If law enforcement has not already done so, you should make sure the proper warning devices are placed at a sufficient distance from the scene to properly warn, slow, and divert oncoming traffic. This will alert motorists coming from both directions that a crash has occurred. When you must work in a traffic lane, park a heavy vehicle such as a fire engine, if available, in a position that blocks traffic in the lane where you are working. Park the ambulance at a safe but convenient distance from the scene. Before attempting to access patients who are trapped in a vehicle, check the vehicle's stability. Then take any necessary measures to secure it. Do not rock or push on a vehicle to find out whether it will move. This can overturn the vehicle or send it crashing into a ditch. If you are uncertain about the safety of a crash scene, wait for appropriately trained personnel to arrive before approaching. It may not be your primary responsibility to ensure safe management of traffic flow, vehicle stabilization, and similar tasks, but it is always your responsibility to see that it has been properly accomplished. When working at night, you must have plenty of light. Poor lighting increases the risk of injury to both you and the patient. It also results in poor emergency medical care. Wearing a reflective vest or clothing will help to make you more visible at night, and decrease your risk of injury. Scene hazards. In the course of your career as an emergency medical technician, you will be exposed to many hazards. Some situations will be life-threatening. In these cases, you must be properly protected, or you must take steps to avoid the hazard completely. Hazardous materials. Your safety is the most important consideration at a hazardous materials incident. Upon your arrival, you should look at the scene, and try to read any labels, placards, and identification numbers from a distance, perhaps using binoculars. Placards are used on transportation vehicles and buildings, and labels are used on individual packages containing hazardous materials. The placards or labels are colored, and diamond-shaped. You should never approach any object marked with a placard or label. Remember, some hazardous materials may not be properly marked. Specially trained and equipped hazardous materials responders will handle disposal of materials and removal of patients. You should not begin caring for patients until they have been moved away from the scene and are decontaminated or the scene is safe for you to enter. The United States Department of Transportation's Emergency Response Guidebook is an important resource when dealing with a hazardous materials incident. The Emergency Response Guidebook lists common hazardous materials, and the proper procedures for scene control, and the emergency care of patients. Some state and local government agencies may also have information about hazardous materials commonly present in their areas. A paper or electronic copy of the Emergency Response Guidebook and other information relevant to your area should be available in your unit. Smartphone and tablet apps with hazmat resource materials are also available. Using these references, you should be able to begin proper emergency management as soon as the hazardous material is identified. Do not go into an area and risk exposure to yourself or your partner. The following are general guidelines you should follow when dealing with scenes involving hazardous materials. Do not enter the scene if there is evidence of hazardous materials. Remain upwind and uphill of the scene. Keep your distance. This may mean retreating if you become aware of the true nature of the situation. Quickly contact dispatch. Request additional resources. Do not enter the scene until instructed by trained hazardous materials responders. Electricity. Electrical shock can be produced by human-made sources, power lines, or natural sources, lightning. No matter the source, you must evaluate the risk to you and your patient before you begin patient care. Power lines. Do not touch down power lines. Dealing with power lines is beyond the scope of emergency medical technician training. You should mark off a danger zone around the downed lines. Energized, or live, power lines, especially high-voltage lines, behave in unpredictable ways. You need in-depth training to operate the equipment that is used in an electrical emergency. The equipment has specific storage needs, and requires careful cleaning. Dirt or other contaminants can make this equipment useless or dangerous. At the scene of a motor vehicle crash, above-ground and below-grade power lines may become hazards. Disrupted overhead wires are usually a visible hazard. You must be very careful even if you do not see sparks coming from the lines. Visible sparks are not always present in charged wires. The area around downed power lines is always a danger zone. This danger zone extends well beyond the immediate accident scene. Use the utility poles as landmarks for establishing the perimeter of the danger zone. The danger zone must be a restricted area. The safety zone is one span of the utility pole's distance. Only emergency personnel, equipment, and vehicles are allowed inside this area. Do not approach downed wires or touch anything with which downed wires are in contact until qualified personnel have concluded that no risk of electrical injury exists. This may mean you are unable to access a severely injured victim of a motor vehicle crash even though you can see and talk to the victim. If you must enter this type of situation, be sure to wear the proper protective equipment according to the type of incident. A helmet and turnout gear are typically required, but you cannot count on turnout gear for protection from electrical hazards. Other protective equipment may be needed. Lightning. Lightning is a complex natural phenomenon. It is untrue that lightning never strikes in the same place twice. Lightning is a threat in two ways, through a direct hit, and through ground current. After the lightning bolt strikes, the current drains along the earth, following the most conductive pathway. Although you should avoid high ground to avoid a direct strike, to avoid being injured by a ground current, stay away from drainage ditches, moist areas, small depressions, and wet ropes. If you are involved in a rescue operation, you may need to delay rescue until the storm passes. Recognize the warning signs just before a lightning strike. As your surroundings become charged, you may feel a slight tingling sensation on your skin, or your hair may even stand on end. In this situation, a strike may be imminent. Move immediately to the lowest possible area. If you are caught in an open area, make yourself the smallest possible target for a direct hit or for ground current. To avoid being hit by the initial strike, stay away from projections from the ground, such as a single tree. Drop all equipment, particularly metal objects, that project above your body. Avoid fences and other metal objects. These structures can transmit current from the initial strike over a long distance. Position yourself in a low crouch. This position exposes only your feet to the ground current. If you sit, both your feet and your buttocks are exposed. Place an object made of non-conductive material, such as a blanket, under your feet. Get inside a car or your unit, if possible, as vehicles will protect you from lightning. Fire. You will often be called to the scene of a fire. Therefore, you should understand some basic information about fire, if you do not know it already. There are 7 common hazards in a fire. Smoke. Oxygen deficiency. High temperatures. Toxic gases. Building collapse. Equipment. Explosions. Smoke is made up of particles of tar and carbon. These particles irritate the respiratory system on contact. Most smoke particles are trapped in the upper respiratory system, but many smaller particles enter the lungs. Some smoke particles not only irritate the airway, but may also be deadly. If you are a firefighter, you will have a self-contained breathing apparatus to use at fire scenes. Fire consumes oxygen. Particularly in confined spaces, fire may consume most of the available oxygen. This will make breathing difficult for anyone in that space. The high ambient temperatures in a fire can result in thermal burns and damage to the respiratory system. Breathing air that is heated above 120 degrees Fahrenheit, 49 degrees Celsius, can damage the respiratory system. A typical building fire emits a number of toxic gases, including carbon monoxide, cyanide, and carbon dioxide. Carbon monoxide is a colorless, odorless gas that is responsible for more fire deaths each year than any other byproduct of combustion. Carbon monoxide combines with the hemoglobin in your red blood cells about 200 times more readily than does oxygen. It blocks the ability of the hemoglobin to transport oxygen to your body tissues. Cyanide is a product of the combustion of many materials that burn. Inhaling cyanide prevents cells from using oxygen. In sufficiently high concentrations, it causes signs and symptoms of shock and severe hypoxia leading to death. Carbon dioxide is also a colorless, odorless gas. Exposure causes increased respirations, dizziness, and sweating. Breathing concentrations of carbon dioxide greater than 10% to 12% will result in death within a few minutes. During and after a fire, there is always a possibility that all, or part of the burned structure will collapse. Often, there are no warning signs. As an emergency medical service provider, you should never enter a burning building without proper protective gear, breathing apparatus, and approval. Always follow the instructions of the incident commander and safety officer at the scene, and never undertake any task, that is, enter a burning structure or initiate search and rescue, unless you have been properly trained to do so. Hasty entry into a burning structure may result in serious injury, and possibly death. Once inside a burning building, you are subject to an uncontrolled, hostile environment. Fires are not selective about their victims. You must be extremely cautious whenever you are near a burning structure or one in which a fire has just been placed under control. Fuel and fuel systems of vehicles that have been involved in crashes are also a hazard. Although this rarely happens, any leaking car fuel may ignite under the right conditions. If you see or smell a fuel leak, or if people are trapped in the vehicle, you must coordinate appropriate fire protection equipment. Gasoline and other auto fluids are considered hazardous materials. Make sure you are properly protected if there is or has been a fire in the vehicle. Wear appropriate respiratory protection and thermal protection because the smoke from a vehicle fire contains many toxic byproducts. The use of appropriate protective gear at a crash scene can reduce your risk of injury. Avoid using oxygen in or near a vehicle that is smoking, smoldering, or leaking fuel. Vehicle crashes. Vehicle crashes are common events for emergency medical service providers. These environments provide some of the most unstable and potentially lethal situations you will face. Traffic hazards are the first risk to consider. As you drive your ambulance to the scene of the crash, it is important to keep several things in mind. What is the flow of traffic near and around the crash? How will you safely leave and move about the scene? Ideally, you should park your ambulance in a manner where you can easily leave the scene. Keep in mind that additional fire, rescue, and police vehicles may also be parked in the same area, or they may be blocking your exit. Hydraulic and hose lines are just two examples of common blockages you may encounter. If you are the first to arrive at the scene, use the ambulance itself as a shield to protect the scene. The ambulance can be relocated for easier exit once additional help arrives. Park at least 100 feet, 30.5 meters, away from all crash sites. As you approach the scene, be very conscious about the flow of traffic. If needed, request assistance to control traffic. Traffic control will help ensure a safe scene as you work with patients. How is the vehicle positioned? Is it stable? Cars and trucks can come to rest in a wide array of positions. As the center of gravity of the vehicle is raised, its ability to fall onto you increases. The standard approach for all vehicle crashes should be for firefighters to first stabilize the vehicle to ensure safety for the passengers and any emergency medical service providers. Identify any other hazards such as fluids leaking from the vehicles, which can be flammable. Fluids, dirt, sand, gravel, glass, and other materials on or around the roadway may cause slip and driving hazards. Additional hazards include power lines. Downed lines can generate lethal electrical charges many feet away from vehicle crashes. If there are lines down, you should assume they are power lines, and do not approach. Call for additional resources to manage this hazard. Be aware that most electric companies will not shut down power to the grid. Although this seems like a logical solution, many injuries can be caused by an unscheduled power outage. If people in their homes are on ventilators or other life-saving medical devices, this could create another emergency situation if the power were shut off. With proper equipment and training, you may enter the vehicle. If the vehicle is still running, put it in park, and turn off the ignition. If the airbag has not deployed, there is a risk that it may accidentally activate while you are in the vehicle. Likewise, alternative fuel vehicles, including hybrid or electric vehicles and vehicles powered by propane, natural gas, or fuel cells, present their own unique hazards when damaged in collisions. Although it may not be your primary job to resolve all of the hazards associated with every type of vehicle, it is important for you to be aware of issues, and seek to identify clues such as marked warnings, smoke or smells in or around the vehicle, or other signs of danger. When you identify a concern, speak up to your partner and other emergency response colleagues. Your personal clothing will help you to remain safe while working in and around a vehicle crash. The risk of injuries from glass and sharp metal objects cannot be underestimated. If you are working inside the vehicle, make sure you have sufficient protective gear. Scenes of violence. Sometimes emergency medical technicians will be at a scene where a clearly dangerous situation is underway, such as an assault, a shooting, a hostage situation, a riot, or other disturbance. Assessment of the scene should begin while you are en route. Once on scene or at your staging location, continue your assessment using your personal observations, what you see and hear, as well as information that you can gather from other responders. Your safety and that of your team is of primary concern. You must thoroughly understand the risks of each environment you enter. Whenever you are in doubt about your safety, do not put yourself at risk. Mass violence. Scenes of mass violence such as shootings or bombings, civil disturbances, and large gatherings of hostile or potentially hostile people can create many hazards for emergency medical service personnel. Several agencies will respond to large civil disturbances. In these instances, it is important for you to know who is in command and will be issuing orders. In some cases, especially if the violence has only just occurred, other responders may not be aware of the situation. In other cases, the dispatch information may not reflect the potential for violence at all. In these situations you should call for law enforcement immediately if they are not already present. It is not unusual to find yourself on a call where the potential for violence is present but is not immediately clear. You must remain vigilant for the potential for violence at all times. As part of your scene size-up, evaluate the scene for the potential for violence. When appropriate, allow law enforcement personnel to secure the scene before you approach. They have the necessary experience and expertise in handling these situations. They may ask you to remain in a safe location, until the scene is more secure and you can proceed. Remember, addressing your personal safety is your first task. You must attempt to understand the risks of each environment you enter. Whenever you are in doubt about your safety, do not put yourself at risk. At scenes involving projectiles such as bullets, bottles, and rocks, you may need to find protection. When approaching the scene, look for areas of concealment or cover. Cover involves the tactical use of an impenetrable barrier for protection, whereas concealment involves hiding behind objects to limit a person's ability to see you. Do not depend on someone else for your safety. Remember, you and your partner must be protected from the dangers at the scene before you can provide patient care. A crime scene often poses potential problems for emergency medical service personnel. Perpetrators may be on the scene or reappear, and threaten you, your partner, or the patient. Bystanders or family members may interfere with your emergency medical care. Be sure you have adequate assistance from the appropriate public safety agency in these situations. If you believe an event is a crime scene, you must attempt to maintain the chain of evidence. Do not disturb the scene unless it is absolutely necessary in caring for the patient. Violence against responders. In some cases, emergency responders might be the direct target of violence. The rate of violence-related injuries with work loss for emergency responders is 22 times higher than the overall rate for other employees in the United States. Ensuring health and wellness in the face of violence against emergency medical service providers demands strategies of prevention and strategies of protection. Recommendations for the prevention of violence include the following: training and practice in identifying scenes of potential violence. Training and practice in de-escalation strategies and techniques. Training and practice to improve interpersonal communications. Practice in ongoing scene assessment. Dispatch identification and alerting of past or potential threats of violence. Recommendations for protection against violence include the following: training and practice in self-defense and escape techniques. Training and practice in physical and chemical restraint techniques. Fitting and use of body armor. Training and practice in operations with law enforcement personnel. Emergency medical technicians who experience physical or verbal violence should report this on the appropriate incident form. Follow your state laws and department policies to report instances of physical assault. Protective clothing. Preventing injury. Wearing protective clothing and other appropriate gear is critical to your personal safety. Become familiar with the protective equipment that is available to you. Then you will know what clothing and gear are needed for the job. You will also be able to adapt or change items as the situation and environment change. Remember, protective clothing and gear provide protection only when they are in good condition. It is your responsibility to inspect your clothing and gear. Learn to recognize how wear and tear can make your equipment unsafe. Be sure to inspect equipment before you use it. Ideally, this is done before reaching the scene so care is not delayed. Clothing that is worn for rescue must be appropriate for the activity and the environment where the activity will take place. For example, turnout gear worn for firefighting may be too restrictive for working in a confined space. In every situation involving blood and/or other body fluids, follow standard precautions. You must protect yourself and your patient by wearing gloves and eye protection, as well as any additional protective clothing that may be needed. Emergency medical service coats should provide a barrier to body fluids if they were purchased after 1998. Cold weather clothing. When dressing for cold weather, you should wear several layers of clothing. Multiple layers provide much better protection than a single thick cover. You have more flexibility to control your body temperature by adding or removing a layer. Cold weather protection should consist of at least the following 3 layers. 1. A thin inner layer, sometimes called the transport layer, next to your skin. This layer pulls moisture away from your skin, keeping you dry and warm. Underwear made of polypropylene or polyester material works well. Wool is the best natural fiber. The goal is to wick moisture away from the skin. 2. A thermal middle layer of bulkier material for insulation. Wool has been the material of choice for warmth, but newer materials, such as polyester fleece, are also commonly used. 3. An outer layer that resists chilling winds and wet conditions, such as rain, sleet, or snow. The 2 top layers should have zippers to allow you to vent some body heat if you become too warm. When choosing protective clothing, you should pay attention to the type of material from which it is made. Cotton should be avoided in cold, wet environments. Cotton tends to absorb moisture, causing chilling from wetness. However, cotton is appropriate in warm, dry weather because it absorbs moisture and pulls heat away from the body. As an outer layer in cold weather, you might consider plastic-coated nylon, as it provides good waterproof protection. However, it can also hold in body heat and perspiration, which makes you wet both inside and out. Newer, less airtight materials allow perspiration and some heat to escape while the material retains its water resistance. Avoid flammable or meltable synthetic materials anytime there is any possibility of fire. Turnout gear. Turnout gear, or bunker gear, is a fire service term for protective clothing designed for use in structural firefighting environments. Turnout gear provides some protection by using different layers of fabric or other material to provide protection from the heat of fire. It also helps to reduce trauma from impact or cuts, and keeps water away from the body. Like most protective clothing, turnout gear adds weight, and reduces range of motion to some degree. The exterior fabrics provide increased protection from cuts and abrasions. They also act as a barrier to high external temperatures. In cold weather, an insulated thermal inner layer of material that helps to retain body heat is recommended. Turnout gear or a bunker jacket provides minimal protection from electrical shock. However, it does protect you from heat, fire, possible flashover, and flying sparks. The front opening of the jacket should be fastened, and the jacket should be worn with the collar up and closed in front to protect your neck and upper chest. Proper fit is important so that you can move freely. Gloves. Firefighting gloves provide the best protection from heat, cold, and cuts. However, these gloves reduce manual dexterity. In addition, firefighting gloves will not protect you from electrical hazards. In rescue situations, you must be able to freely use your hands to operate rescue tools, provide patient care, and perform other duties. Wearing puncture-proof leather gloves and latex gloves underneath will permit free use of your hands, and offer added protection from both injury and body fluids. Helmets. You should wear a helmet anytime you are working in a fall zone. A fall zone is an area where you are likely to encounter falling objects. The helmet should provide top and side impact protection. It should also have a secure chin strap. Objects will often fall one after another. If the strap is not secure, the first falling object may knock off your helmet. This leaves your head unprotected as the remaining objects fall. Construction-type helmets are not well suited for rescue situations. They offer minimal impact protection, and have inadequate chin straps. Modern fire helmets offer impact protection. However, the protecting brim at the back of the neck may get in your way in a rescue situation. In cold weather, a great loss of body heat occurs if you are not wearing a hat or helmet. An insulated hat made from wool or a synthetic material can be pulled down over the face and the base of the skull to reduce heat loss in extremely cold weather. You should always wear a helmet with a chin strap and face shield in situations involving electrical hazards. The shell of the helmet should be made of a certified electrical non-conductor. The chin strap should not stretch. In fact, it should fasten securely so the helmet stays in place if you are knocked down or a power line hits your head. You should also be able to lock the face shield on the helmet. This will protect your face and eyes from power lines and flying sparks. A standard fire turnout helmet should meet all of these needs. Boots. Boots should protect your feet. They should be water resistant, fit well, and be flexible so that you can comfortably walk long distances. If you will be working outdoors, you should choose boots that cover and protect your ankles, keeping out stones, debris, and snow. Steel-toed boots are preferred. In cold weather, your boots must also protect you from the cold. Leather is one of the best materials for boots. However, other materials, such as any waterproof, windproof, and breathable fabrics, are also very good. The soles of your boots must provide traction. Lug-type soles may grip well in snow, but they become very slippery when caked with mud. Properly fitted boots and shoes are extremely important, because a minor annoyance can develop into a disabling injury. Painful blisters may develop if your feet slip around inside your boots, so make sure you have enough room to wiggle your toes. Boots should be puncture resistant, protect the toes, and provide foot support. It may be difficult to obtain a good fit with firefighting boots. Shoe inserts or sock layering may be needed to ensure a comfortable fit. Make sure the tops of your boots are sealed off to keep rain, snow, glass, or other materials from getting into your boots. Moisture increases blistering. Wool or wicking socks help prevent feet from becoming wet. Socks will keep your feet warm and provide some cushioning for you as you walk. In cold weather, 2 pairs of socks are generally preferable to 1 thick pair. A thin sock next to the foot helps to wick perspiration away to a thicker outer sock. This tends to keep your feet warmer, drier, and generally more comfortable. When you purchase new shoes or boots, you may want to try them on while wearing the 2 pairs of socks to ensure a proper fit. Eye protection. The human eye is very fragile, and permanent loss of sight can occur from minor injuries. You need to protect your eyes from blood and other body fluids, foreign objects, plants, insects, and debris from extrication. You may wear eyeglasses with side shields during routine patient care. However, when tools are being used during extrication, you should wear a face shield or goggles. In these instances, prescription eyeglasses do not provide adequate protection. In snow or white sand, particularly at higher altitudes, you must protect your eyes from ultraviolet exposure. Specially designed eyeglasses or goggles can provide this. In addition, your eye protection must be adaptable to the weather and the physical demands of the task. It is critical that you have clear vision at all times. Ear protection. Exposure to loud noises for long periods of time can cause permanent hearing loss. Certain equipment, such as helicopters, some extrication tools, and sirens, produces high levels of noise. Wearing soft foam industrial-type earplugs usually provides adequate protection. Skin protection. Your skin needs protection against sunburn while you are working outdoors. Long-term exposure to the sun increases the possibility of skin cancer. It may be considered simply an annoyance, but sunburn is a type of burn injury. In reflective areas such as sand, water, and snow, your risk of sunburn increases. Protect your skin by applying sunscreen with a minimum sun protection factor of 15. Hair, rings, and jewelry. You need to be careful when wearing long, unsecured hair, loose rings, and jewelry. For example, these items can become caught in machinery during extrication. Due to the multitude of unusual situations in which emergency medical technicians may find themselves, many emergency medical service agencies have restrictive policies regarding hair, rings, and jewelry. You should neatly secure long hair, limit the number of rings worn, and wear only a watch on the wrist. Body armor. Some emergency medical service responders wear body armor on shift for personal protection from firearms. Several types of body armor are available, offering different features and levels and types of protection. They range from soft, lightweight, and flexible to hard-plated armor that is heavier and bulkier. Lighter vests are commonly worn concealed under a uniform shirt or jacket. The larger, heavier vests are typically worn on the outside of a uniform. Often, lighter body armor for daily wear differs from the heavier, higher levels of protection that are worn for response to scenes of violence. It is important to know what level of protection your body armor provides, and to store it properly to ensure it retains its ability to protect you. Caring for critically ill and injured patients. When you are caring for a critically ill or injured patient, the patient needs to know who you are, and what you are doing. Let the patient know you are attending to his or her immediate needs, and these are your primary concerns at this moment. As soon as possible, explain to the patient what is going on. Confusion, anxiety, and other feelings of helplessness will be decreased if you keep the patient informed from the start. Never assume a patient cannot hear you. Avoid making unprofessional comments during resuscitation, and treat all patients with dignity and respect. Techniques for communicating with a critical patient. Patients who are dying as a result of trauma, an acute medical emergency, or a terminal disease will feel threatened. That threat may be related to their concern about survival. These concerns may involve feelings of helplessness, disability, pain, and separation. Saying the wrong thing may further distress the patient or the patient's family. Knowing how to effectively communicate in these situations can bring the patient needed comfort, which may in turn allow you to provide better care. Avoid sad and grim comments. Emergency medical technicians, other safety personnel, family members, and bystanders must avoid making grim comments about a patient's condition. Remarks such as "this is a bad one" or "the leg is badly damaged," "I think he'll lose it" are inappropriate. These remarks may upset or increase the patient's anxiety and compromise possible recovery outcomes. This is especially true for a patient who may be able to hear but cannot respond. Orient the patient. You should expect a patient to be disoriented in an emergency situation. The aura of the emergency situation, lights, sirens, smells, and strangers, is intense. The impact and effect of injuries or acute illness may cause the patient to be confused or unsettled. It is important for you to orient the patient to his or her surroundings. Use brief, concise statements such as, "Mr. Rosa, you've had an accident, and I am now splinting your arm. I'm Mike Short of Ridgefield Emergency Medical Service. I'll be caring for you." Be honest. When approaching any patient, you must decide how much information each patient is able to understand and accept. You should be honest without further alarming the patient or giving unnecessary information or information that may not be understood. Simply explain what you are doing and allow the patient to be part of the care being given. This can relieve feelings of helplessness as well as some of the fear. Allow for hope. In trauma and acute medical conditions, patients may ask you whether they're going to die. At these times, you may feel at a loss for words. You may also know, on the basis of past experience or in view of the seriousness of the current situation, that the prognosis is poor. However, it is not your decision to tell the patient that he or she is dying. If there is the slightest chance of hope remaining, you want that message transmitted in your attitude, and in the statements you make to the patient. Locating and notifying family members. Many patients will be concerned and ask you to notify their family or others close to them. The patient may not be able to assist you in doing this. In these cases, you should make sure an appropriate and responsible person makes an effort to locate the desired persons. Assuring the patient that someone is going to make these notifications may be an important aspect of the patient's care because it will help to calm the patient. Injured and critically ill children. Injured and critically ill children who have life-threatening conditions should be cared for the same as any adult patient would, insofar as assessing airway, breathing, and circulation and addressing immediate life threats, airway, breathing, and circulations. Due regard should be given to variations in height, weight, and size when providing emergency medical care to pediatric patients. Because of the increased commotion, and the extraordinary nature of the emergency scene for a child, it is important that a relative or responsible adult accompany the child at all times to relieve anxiety, and assist in care as appropriate. Coping with the death of a child. The death of a child is a tragic and dreaded event. It will not be unusual for you to think about the fact that the dead or dying child still has a lot more to do in life, and should have many more years to live. In our society, we often assume only older people are supposed to die. Many people are unprepared for what they will feel when a child dies. You may think about your own children, related children, and children of close friends. Answering the difficult questions of your own mortality will help you deal with the death of a child. Still, the death of a child will never be an easy subject to talk about. This will be especially so for the child's family, and as an emergency medical technician involved in a call that involves the death of a child, you will also likely experience stress. One of your responsibilities may be to help the family through the initial period after the death. As an emergency medical technician, until more definitive and professional help can be arranged, you may be in the best position to help the family begin to cope with their loss. How a family initially deals with the death of a child will affect its stability and endurance. You can help a family through their initial period of grief, and provide information about follow-up counseling and support services that are available. Helping the family. Whether the child has just died in your presence or was dead when you arrived, acknowledging the death is important. This should be done in a private place, even if that is inside an ambulance. Often, the parents cannot believe the death is real, even if they have been preparing for it, as in the case of a terminal illness such as leukemia. Reactions vary, but shock, disbelief, and denial are common emotions and reactions. Some parents show little emotion at the initial news. If it is possible and appropriate, find a place where the mother and father can hold or touch the child. This is important in the parent's grieving process. It helps to lessen the sense of disbelief, and makes the death real. Even if the parents do not ask to see the child, you should tell them that they may do so. However, this may not be possible if it is a crime scene. Your decision in permitting the parents to see the child may require some discretion on your part. For example, in the case of a traumatic death in which there is significant disfigurement of the body, the decision whether to see the child might have to be delayed. The delay may involve waiting for support services or contacting the family physician or others who can help the parents through this difficult situation. This situation may also involve preparing the parents for what they will see, and the changes brought on by rigor mortis or asphyxiation, for example. Sometimes, you do not need to say much. In fact, silence can sometimes be more comforting than words. You can express your own sorrow. Do not overload grieving parents with a lot of information. At this point, they cannot handle it. Nonverbal communication, such as holding a hand or touching a shoulder, may be more valuable. Let the family's actions be your guide to what is appropriate. If you sense the parents want to talk, it is important for you to encourage them to talk about their feelings. Death and dying. Death can occur in the hospital, a hospice facility, or convalescent home, at the workplace, or on the highway, and death is likely to occur either quite suddenly or after a prolonged illness. Illness can be much more drawn out and much more removed from daily life. Life support systems and impersonal care remove the whole experience of death from most people's awareness. The mobility of families also makes it less likely there will be extended family support when death does occur. You may have painful personal experience with death. No matter what the frequency of response to emergency calls, death is something that every emergency medical technician will face at some point. For some of you, it may be infrequent. Others, in urban settings, may see death many times in responding to motor vehicle crashes, drug overdoses, suicides, or homicides. You may have to deal with the mass casualty incident of an airplane crash or a hazardous materials incident. In all of these situations, coming to grips with your thoughts, understanding, and adjustment to death is not only important personally, but also a function of delivering emergency medical care. The grieving process. Everyone working as an emergency medical technician will experience grief at one time or another. This section discusses how to handle patient grief, as well as how to cope with your own grief that may result from a difficult call. The death of a human being is one of the most difficult events for another human being to accept. For a relative or close friend of the deceased, it is even more difficult. Emotional responses to the loss of a loved one or friend are